The lady who's fallen out of a tree 2 metres, my primary concern is the mechanism of injury and how she may have hurt in her back or spinal in any way. So we arrived at the scene. There's no obvious danger. I can see we've got our PPE on. Are you safe to go in?
Yes, I'm safe.
Cool. So arrived. Hey, can you tell me your name, please?
Jono,
Can you tell me what happened?
I fell out of a tree.
Also, Jana's talking to me. She's her airway's open and she's also breathing, so that's good. I can see she's holding her left forearm. Can I take that with us?
Yeah.
Cool. So I'm going to get you to apply pressure for that.
Yeah.
I'm just going to get a combined dressing. I'm going to get saline to clean the wound. Fold it over for a better surface area, and then I'm just going to dress it up with a bandage. I'm going to twist it 180 for a more direct pressure onto the wound. Once I've done this, I'm then going to do a quick blood sweep to see if there's any other injuries anyway. So is that right if I can just feel around for any blood? So I'm just feeling for any, looking on that gloves for any blood. She's wearing dark clothing, so I could cut and expose to see if there is any. Okay, so there's no obvious blood that I can see. I can see that the bleeding is still coming through, so I'm going to get another combined dressing, wet it with the saline so it doesn't stick. Hold that, and then I'm just going to add more direct pressure. Yep. Again, twisting for a more direct, localized area. So I see that it's still bleeding through, so it must be a pretty deep cut. I'm going to apply a 20K. 20K should be applied 10 centimetres above the wound and on a long single bone. So I'm going to tighten up. In this case, for this scenario, I'm just going to loosely do it. I'm also just going to write down the time, and it's not going to be taken up until we get to hospital. I'm going to be checking that there is no pulse, so that means that the bleeding has stopped. I'm just going to take this off just to have a look. So I don't see any more blood that it's stopped, so I'm just going to carry on. I'm going to do, is it right if I do another trauma check? Yeah. Okay, so I'm going to do another trauma sweep, feeling for any other injuries, right? Okay. So if you just tell me what hurts. Yeah?
Ow.
Okay, so where's it hurt?
My neck, yeah.
Is it in the middle or the side?
In the middle.
Cool. I'm just going to, can you hold her head still?
Yeah.
I'm just going to feel around for any other injuries. Feeling for any lumps, bumps, or bruises.
Ow.
Okay, so you hit your ankle.
Yeah.
I'm just going to cut and expose, so looking for, I'm going to be feeling for a pedal pulse for both, and I do feel it on both. This one's a little weaker, but it is there, so there is blood getting through the limbs, so I'm going to come back to the neck injury and going to put a seat collar on. Contraindications for this is surgical airways and penetrating neck injuries. So I'm going to measure it first, measuring with my fingers from clavicle to mandible. It's about 4 fingers. From the bottom, I'm just going to, yeah, so it is the right for me, so I'm just going to get you to lift the head. Alright. Yeah. Well, this may be a bit uncomfortable, but I'm putting this on for the neck stabilisation, right?
Yeah.
And then I'm going to go and look at the skin. So I'm looking for the colour, if it's the same colour on both legs, which it is. And I did feel a pulse in there. I'm gonna. Okay, so I'm also looking for any neurological effects. So I'm gonna. Can you feel my feet and my hands? Sorry.
Yeah.
Can you push? Yeah. Can you pull? Yeah. So the neurological is all fine. If you could get a spin ready, and I'm gonna take some vitals. Is it alright if I do a set of vitals on you, including blood pressure?
Yep.
Yeah. Have you ever had a blood pressure done before?
Yes.
So you know it gets quite tight.
Yeah.
Okay. So I'm going to do it over here. First of all, I'm going to check the heart rate. So I'm just going to lie your hand here while timing it for about 6 seconds and then timing it by 10. And I could also do that times 15 seconds times by 4. I got a heart rate of about 88. Normal is 60 to 100, so that's pretty high, I'm going to guess because of the fall and shock. Also, I'm checking for respiratory rate, which is about 18, which is a bit fast because obviously she's just had a fall, so I expect that. I'd also check the oxygen saturation. I'd expect it to be a little low due to the blood loss, so I could administrate oxygen via nasal cannula of 2 to 4 litres per minute. I'm now just going to do the blood pressure. Curl your arm again. So what were you doing up the tree?
I was trying to cut the tree down because it's getting too big.
So I can pump it up first, feeling for the systolic number, which is the top when I first stopped feeding it. So I felt around 130, and I'm just going to listen for the diastolic. Okay, and then lower number is what's 80, so that's okay. Normal blood pressure is 120 over 80. So I'm going to now, once I finish the blood pressure, I'm going to do auscultations. Is it alright if I have a listen to your lungs?
Yep.
Okay. So I'm going to go under your shirt and I'm going to ask you to deep breath in and out. Go with it. Deep breath in. And. Is it right if I can't hear?
Yep.
And then deep breath in. And last one. Okay, so that's all right. Now I'm just going to ask about pain. On a pain scale, 1 being no pain, 0 pain, no pain, 10 being the worst. What pain scale are you on?
8.
8. So I'm going to give you a drug called fluoxyfluorine. Have you ever heard of this before?
No.
No. Have you ever heard of ligament hypothermia?
No.
Have you got any known renal problems?
No.
Okay, so I'm going to give you this drug. This will help with the pain relief. I'm going to first check it and check it's the right drug and the right amount that I'm giving and the expiry date, and then give it to my officer to tell me.
So we've got methoxyfluorine, expiry date 1st of January 2019, and it's 3 mils.
Cool, so that's what I had in my mind. I'm going to give it to you now, alright? And then you just breathe in and out through the whistle, alright?
Okay.
And then I'm going to move on to the light, the splint. Cool. Cool, I'm going to get offside to lift the leg while I put this underneath. This might hurt lifting the leg up, so I'm going to need you to just keep breathing on that pain relief, alright?
Okay.
Cool. So I put a towel over to fill in the natural curves in the leg. So I'm going to ask what your pain scale is right now. Again.
About 4 now.
Of course, it's gone down. So if you keep using it, it'll be better for this. And I'm going to ask you to lift it up. All right. So 3, 2, 1. And I'm going to put these underneath. A bit tangled. Cool, right, put it down. If you tie the top two, not the bottom one. A figure of 8 at the bottom to go around. Now it's in the splints, I'm now going to recheck the leg, so I'm feeling for the pedal pulse in both. I do feel them, so there still is a pulse. I'm gonna. Can you push? Yeah, and then can you pull? Yeah. And the temperature looks alright from what I see. So.